My name is Dr. Jacobs. I am the program director of the MA program in AIMS Education. I've been working here more than 10 years in the school. I've been medical doctor for more than 12 years. I work in the emergency room for many hospitals. Now I am working with AIM Education College of Health Science. The program is designed to get entry level in the healthcare community. The student will have a lot of administrative and clinical skills that make them partner in the healthcare facility and help the physician add bridge between the patient and the physician with a lot of professionalism and skills. The MA program is designed to give the student the background like medical terminology, and then we give them anatomy and physiology. After that, we give them a good communication through the class which is called ethics. And this how to communicate with different type of patient, communicate with the family, communicate with even the physician and any consultant. Also, we give them phlebotomy. The student know how to give vaccination, how to do injection, how to collect the blood from the patient. And after that, we give the student idea about the EKG, the electrocardiograph, how the student can apply the electrode to the patient, and how they can interpretation and give idea about the cardiac system of the patient. We move after that to the medical administrative. A lot of stuff in the front desk like schedule the patient, making the patient medical records, and how to making the billing and the statement for the patient, and how to do the inventory, a communication with the patient by the phone, and checking the insurance is the most important job, especially in the front desk. After that, we're going to the clinical medical assistant, where the student learn a lot of skills that making them professional medical assistant. They can do the patient physical exam, vital sign, eye examination. Also, they can learn how to do some urine analysis, how to inject the drugs, administration of the drugs in different way. And also we examine pediatric examination, gynecological examination, immobilization, first aid, emergency. All this stuff needed. The medical assistant is the one who have a lot of scope of practice that can do everything for the patient in different health facilities. And the program, it done in 10 months. And it gives the student at the end 30 credits. And after that, the student can apply for the certification exam